echo my thanks and gratitude for you all and the work that you've been doing in terms of the last 2.5 years, really educating us, educating other elected officials, or at least trying, and some of them just don't want to get it, and really, helping to frame this conversation in a way that is productive. And in a period of time in our civic discourse where framing controversial issues in a way that is approachable is, frankly, a rarity these days. I'm really appreciative of your efforts and your desire to want to work with the city in partnership and with communities who might have concerns about this in partnership to really make sure that everybody's hearing each other as we all collectively struggle with the reality of the opioid crisis. And those are tough conversations to have, and they're ones that we really need to have. And I appreciate the thoughtfulness with which you all have approached the community engagement work over the last 2.5 years. And I hope to see that continue, of course, thoughtfully, but with a sense of urgency. That's going to be my tagline here on this one.
Not mine.
And you don't want it to be thoughtful or urgent?
I don't.
Okay.
Just kidding.
And so I think, I think, I'll also just add that that as we continue to do this work, part of the conversation that I think sometimes we don't include in our conversations around this is, we tend to talk about the worst outcome possible of opioid drug use is death, right? And it is. That is, I read some statistics that show that is true. When we talk about why this is a public health strategy, I think it's also important for us to remember about all the other shy of death public health concerns that a CHEL that includes a safe consumption site like a needle exchange program helps to prevent and mitigate and treat, right? So hepatitis, AIDS, HIV, all of these things are things that we could address through this public health strategy as we move forward. And so I think it's important to talk about the full spectrum of potential outcomes that includes preventable deaths, but also includes a lot of other types of public health concerns that fall clearly under the rubric of our public health authority as a local jurisdiction to address.